my interest in reflexes started in the year of 2000 when someone asked me to volunteer to work with especially children with autism. And back in the year of 2000, not much people in the professional area is willing to help children with autism. So my friend asked me back then, and I say, okay. And back in that time, the first thing that I used to do is working with the behavioral therapeutic and also sensory motor therapeutic. So what interests me is that when I was introduced with the kinesiology model, and it's kind of all for me, with the muscle test, and then we can find out what is exactly the need for the children. And I remember back then that someone introduced me with the primitive reflexes, and when I using the primitive reflexes along with the kinesiology modalities, including touch for health and other kinesiology model, it was really helpful for children with special needs. At the end, I faced with a challenge, and the challenge was with the motor reflex and fear paralysis reflex. Okay, I really need to find a way to balance. I need to find a way how to handle and help children with the fear paralysis reflex and the motor reflex. Okay, and any modalities in primitive reflexes that I learned also said it's very challenging and it's very sensitive for children to have those two reflexes to be balanced or integrated. Fear paralysis reflex is intrauterine reflex, which happen in the womb and also integrated in the womb. Okay, but motor reflex is emerged in the womb, but it will integrate it approximately 3 months after birth. And those two reflexes was a big obstacle for any special needs children that I support in Indonesia back then. I found that using the acupuncture points somehow can help them to have those reflexes integrated in a smooth way. The reason is because through the acupuncture points, they can have the endorphin release, so that when we work with the primitive reflex, such as fear paralysis reflex and motor reflex, which are sensitive, it's quite sensitive to be integrated, we're using the stimulation to the acupuncture point, it's help them to relax during the process. Because the obstacles that we often have is that when we work with any sensory motor stimulation or any kinesiology stimulation that we have, if those two reflexes triggered, somehow it will throw them back into that reflexes, and then they will withdraw from the surrounding, from the social exploration and communication. I'm using the point of view of classical Chinese medicine. I go back to the literature back then and using this perspective, and then I got so many ideas from the energetic perspective how to support that children. So, for instance, as an acupuncturist, I did my best to understand what is the concept of brain. Okay, because definitely everyone who exposed to anatomy and physiology, they may understand about the anatomy and physiology, especially for the neural and also for the brain. But what about as a Chinese medicine practitioner? What about as an acupuncturist? How I see children from the perspective of meridians. That's quite intriguing back in that time. Brain, if you take a look on the 5 elements model, in Touch for Health level 2, you learn about 5 elements, right? And in the 5 elements, you learn that it's related to the 5 organs, okay? And if you take a look, maybe you are going to think, why we don't have brain in that part? Why we don't have brain in that elements? But in the anatomy physiology, we know that brain and the neural is one of the important organs. as a human. Well, in any creature as well, but particularly in human. So why we don't have those 5 elements? It doesn't mean that in Chinese medicine we didn't recognize the existence of the brain. Of course, we recognize the existence of the brain, and brain is considered as a spatial organs. So in the classical Chinese medicine, we have what we call with the spatial organs. First is gallbladder, second is uterus, and also brain. So brain is considered as a spatial organs. The physiology of the brain in the classical Chinese medicine perspective is a bit different. Okay, this is what it says in the classic. So if you able to maintain your qi, your energy, you can build up blood. If you're able to maintain your blood, then you may able to collect and manage your essence and marrow. Okay, when you say about essence, it's related to the marrow. And then when you able to manage and cultivate your marrow, and then it will build up and fill up into the ocean of marrow. And can you guess what is the ocean of marrow is? The brain. So brain in classical Chinese medicine is related to the ocean of marrow. And then I think in that time, so that means if I want to help children, with especially children, then I need to help them to build qi or energy. Okay, so that's the first thing. So, and then I'm digging on the literature and back to the classics. And then the idea is return to the 5 elements itself. Why? Because in Chinese medicine, and particularly you learn in Touch for Health level 3, you deepen it in the level 3 in Touch for Health, that in every 5 elements, they have their own emotion. Okay, so for example, joy is related to the heart. You call it empathy and sympathy related to the spleen. Okay, to the earth elements, but more information from the classics. So actually, spleen is related to the thinking capacity. So when you're able to focus, it's related to the spleen. Okay, you think about managing your life, it's related to the spleen. Okay, but if you think about managing your life with your spouse, well, definitely it's related to the higher heart. It's different. Okay, so, and then lung is related to the sadness or grief. Okay, so, and then water is related to the anxiety and fear. But in the classics, it's related to the shock. Okay, this one is quite common that I found in my clinic, in my practice, that people have an issue with the shock. Because when you shock, then your system, the qi is moving without a very clear distinction. Okay, it's like scattered. Yeah, and then the wood element, which is liver, is related to anger. Okay, so it means when the children, well, definitely not just children, but everyone, if you're able to manage your emotion and you have balance and you have a sufficient energy on those 5 elements, that's the moment that you can cultivate qi, you can cultivate the energy, and then if you cultivate it into an ample of amount, then it will spill and become blood. That's from the Chinese medicine perspective. And when you have a sufficient blood, then it will flourish and fill up your marrow. And in return, it will nourish your brain, the ocean of the marrow. The next question is about the reflex itself. Why we have reflexes? Why we have primitive reflexes? And why, especially children, they have a problem with their primitive reflexes still hanging around. And and avoid them to access the more higher capacity. Okay. So the answer is I found in the classic of gynecology. So in Chinese medicine, we have a classic literature on the gynecology aspect. And it says during the pregnancy, the 9 months of pregnancy, in every month, the energy is moving into the certain elements and organs. For instance, like the first trimester, it moving in the wood element, the gallbladder and the liver. So that's one of the reasons why most ladies during pregnancy at the first trimester, usually they're looking for sour things. Yeah. So in Indonesia, usually they're looking for mango, young mango. Okay. So it's quite sour. At the end of the pregnancy is the bladder meridian. It means starting from the division of the cell, actually, starting from the division of the cell. I still remember someone from Japan. His name is Tohaku Ishii. Yeah? So he made a research on the cell division after the conception. Okay. And then he found that actually the meridians is started from the divisions of the cell. So, you know, the division of the cell after conception, from 1 become 2, 2 become 4, 4, 8, 8, 16, and so on and so on. So the meridian is running not in the cell, but outside of the cell, extracellular level. Can you imagine that? So the first division of the cells become 2. You can imagine if this is a cell, 2 cells. So this is central and governing meridians. Okay. So when 2 become 4, can you imagine like you have a 4 balls stacked like that? Okay. So this is the belt channel, central and governing. So it means the more cells divided back in that time, then the more meridians. And the first meridians to appear after hours after the conception is extra meridians channel. And that's related to one of my professor research. His name is Kusnadi Saputra. Okay, my professor in acupuncture. He made a research on a large intestine meridian. So he injected technetium perthanate in the large intestine number 4 over here. Okay. You know, large intestine is running from the tip of your index here and then ended on the side of the nose, right? And when he injected this technetium perthanate to be able to scan by the gamma ray from large intestine number 4 reaching to the end of the meridian of large intestine, it took 30 minutes. Yeah, it took 30 minutes. And voila, it is similar to what it says in the literature, in the classic of Nanjing, that the qi in the meridians runs, it needs 28 minutes. Okay, and that's very interesting. And what Professor Kusnadi said, the meridians, the energy is acting like a bioelectrical and running outside of the cell, and it acts as a communication among cells. So our cellular is communicated, and so that's the meridians actually. So one of the reasons why we prick a needle is because when we prick the needle, stainless needles, there is an ion jumps and stimulate the cells. So it's like returning the communication back to the cells. Okay. So sometimes I talk to my patients. Okay, so if someone asks you what is acupuncture, you can explain it very easy. It's an electrical communication among our cells. Okay, you know when you want to call someone and your mobile have only 3 bars or 2 bars. Okay, something like that. It's a wireless communication. Starting from those idea, and then I noticed the reason why children have a jerky movement, even babies, they have a jerky movement. It's because that's the incidence. They don't have their meridians mature enough. Because the flow of the chi needs what we call with intention. So in Qigong, we call it yi. So that's why in Chinese, we have the saying, yi dao, qi dao. Okay. So I will translate it. Very easy because most kinesiology already know it. Energy follow intention. Very easy. Right? So in China, now you know and practice Chinese, okay? So you can repeat after me. Yi dao, qi dao, okay? So your mind knows, the energy knows, okay? That's the other word, okay? But actually, we also know it in our kinesiology practice. Energy follow intention. So this is, so back then I feel it's so beautiful, okay? It's so beautiful. Why? Because for a baby to be able to refine their movements, they need to fight. They need to move their limbs in such a controlled way, okay? So at the same time, when they move their limbs, they are also exercising their E, their intention. It's beautiful, right? So they are practicing their intention. So that's why when baby have a problem during their infanthood, they fall illness, and then, or maybe they're not having so much practice or exercising on the floor, they also have a problem with developmental. Okay, premature children, and so on. So many problems related illness or so on. So because they don't have those sufficient time to practice Qigong. Well, you can call it now, crawling is baby Qigong. Okay, so actually they're practicing Qigong, okay? They're moving around. That's my story. So maybe you have a question, why, Henry, why the title of your presentation is Queen of the Night? So you know Queen of the Night? The flower, okay? The flower, not prom of the night, that's different, okay? Queen of the night, okay? Not prom of the night, queen of the night. So the flower, it blooms only in a couple in a year, and it blooms in the midnight. Okay. So why I use this title? So in my class, my courses, RAI, I use this logo. When I was small, my mother bought me a book of Mahabharata. It is an ancient story and history of India, okay, about Arjun, the war, and everything. So when I was a kid, I was so immense and so immense with the story of Krishna. So Krishna, one of the hero in the Mahabharata and also Bharata Yuddha. This story is quite familiar in Indonesia because Hindu was the first religion in Indonesia. So Krishna have a very powerful weapon. And the powerful weapon names in English is Queen of the Night. In Indonesia, we call it Wijaya Kusuma. And you know what? Wijaya Kusuma is the only weapon that bring life to the dead people. My presentation, I will close it today. I hope by learning this course, especially during this time, we always remember to create weapon to bring life to people. Yes. Thank you, Sylvia. Thank you, everyone.
Henry, thank you so much.